welcome back into the Doctor's Lounge. Wow, that's a little bit loud. Your host, Dr. Hal, and Everett. That's a little low. We're working on some technical things. We've got some changes here at America's Web Radio. As soon as we get a couple of the bugs knocked out of this. But in the meantime, we're going to bring our special guest in here today.
Hal, let me remind everybody, they can go to our website and watch it live on YouTube, and that's what we're streaming anyway. But they can also go to Facebook, whichever one's easiest for them.
Right. They can actually get questions into us on Facebook.
On Facebook, yeah.
And we can respond in real time to their questions. Today I have a old. I guess that's the wrong word. A very long time and dear friend of mine who is joining us in the Doctor's Lounge. The Doctor's Lounge, by the way, is brought to you by the Docs for Patient Care Foundation, which is the only physician-led healthcare think tank in the country. The Docs for Patient Care Foundation is dedicated to fighting for your healthcare freedom and for the doctor-patient relationship, and we've done this for over a decade. We've worked very hard. You can go to our website at www.d4pcfoundation.org. That's d4pcfoundation.org, and familiarize yourself with the things that you need to know about so that you can arm yourself and be prepared to advocate for yourself and for your family's health care, and that's what we do. So please give generously, and no amount is too small, no amount is too big, and in order for us to continue doing what we're doing here today and all the work that we do throughout the year, we need your support. My guest today is a very, very long-time friend of mine who is a very accomplished pediatric urologist. Dr. Martin Koyle is the chief of pediatric urology at Toronto Sick Children's Hospital, but he has he's well traveled. He actually spent the majority of his career in the U.S. At L.A., at UCLA, and in Denver at the University of Colorado, and then at Seattle as the chair of pediatric urology there. Dr. Koyle is a world-renowned pediatric urologist who is known for his innovation, his contributions to the field of pediatric urology. He has over 350 publications and book chapters, and has served as an editor to the major urology publications, as well as serving on the major associations in pediatric urology in North America. And in addition to that, he has an MBA in management, and he is a true scholar of healthcare policy. And he recently wrote an opinion piece that is yet to be published. It's going to be coming out in the Canadian Urologic Association Journal. And when I read it, I really could relate to it, because it ties together two topics that I have been writing about for years, talking about on this show for years. He's really tied together the topics of physician burnout, as well as the challenges of single-payer health care being back in Canada. And I think that it's really important to tie these together and bring them together, and there was nobody who I thought would be better suited to talk about this than having Dr. Koyle speak about this live on the show. So, Marty, welcome into the Doctor's Lounge.
Thanks, Hal. Nice to be here.
Well, Marty, I'm going to get right to it. You wrote a piece that really moved a lot of people who you shared this with, and we will get this up on the Docs for Patient Care website and on the America's Web Radio Facebook page once it has been officially released. But can you briefly and our audience is a mixed audience, Marty. It's we have in a month we have over 30,000 downloads, and so many of the people who listen to this are physicians and other healthcare professionals, but a lot are lay people who are interested in hearing about healthcare topics. So can you briefly tell our audience what the gist of your article was and what compelled you to write it?
So I think when you get older, as both of us have, you start reflecting and ask where you are and what's driven you and what's brought you joy in your career and your life, etc. And I was just thinking how, it was so much fun when I was younger, and whether it was because of the healthcare system, whether it was because of the camaraderie, whether it was because of places I lived compared to where I am now, I just felt that I wasn't getting the same joy and satisfaction of coming to work every day. And when you start reading more about burnout, I realized that I was on the road or directly in the jaws of burnout, and I felt that, again, as a senior person, it's important to admit it and to let other people know that it is a problem and it's something you need to deal with. You can't keep it internally. So, fortunately, I am an associate editor of the journal, which allows me some freedom to submit my views, and I wrote a piece, and the senior editor who wrote the introduction to my opinion, I think was quite complimentary and supportive of bringing this up as a topic, at least for the Canadian public, and hopefully, again, it's something that's not unique to me, that will also be reflective of how you and others may feel in the U.S.
Marty, there's so much to unpack here that hopefully we'll have an opportunity to do it in just an hour. But
now I've lost the feed from you. I can't hear you now.
Can you hear me now?
Yeah.
Okay, I'm sorry. So I said that there's so much to unpack here, and hopefully we can do this, cover it.
Gone again.
There's something going on here, Marty. I'm so sorry. Can you hear me now? Can you hear us now?
Yeah, I got you now.
Okay, something's going on. I'm not sure what it is, but there's a lot to unpack here, and I hope that we'll be able to get to everything in an hour. But you mentioned burnout. This is something that our audience has heard me talk about. Why is this important for people other than physicians?
I think, when we've spent long, hard hours becoming who we've become, and part of the of anybody's career, I don't care whether it's a doctor or a lawyer or a plumber, the reality is it's all give and take, and it's a balance in life. And I think what you do for 8 to 10 to 12 to 14 hours of the day, and sometimes taking the work home with you, has to bring joy to you and satisfaction. And when it becomes a job rather than a passion, to me, I think it's time to reflect and ask yourself, is this what I want to do and keep doing for the rest of your life? So reality is, I don't think this is unique to physicians or unique to me or unique to the Canadian versus the American healthcare system. I think we're in a very different world than you and I grew up in, of where disruptive technology has really necessitated that we play a catch-up game, and that we're always behind and trying to catch up. And it's difficult for oldsters like me, and perhaps for you, to embrace newer technologies, newer changes, newer demands, and also to work in a system where there's more demands of us, socially, from our patients, from our hospitals, from our insurers, whoever it tends to be.
Well, what I guess where I was going is, people should be concerned about this and about their physicians burning out, because it will impact the care that patients get when their physicians are feeling stressed, when they are, I view burnout really not so much as a problem where you are having difficulty adapting, but I view it more as a form of PTSD.
Sorry, I lost you again.
You know what? I'm wondering if it may be your on your end, Marty, if it's coming from, because everything.
You want me to try to call back in?
You know what? Can you do that? And let me. I'll just. You know what? We'll have you call back in at the break. Can you hear me now, though?
Yeah.
Okay. So I'm saying that this is really a form of PTSD, I think, more than it is a individual challenge to doctors and problems with them adapting. I like the term that your editor for your journal coined, which is moral injury. That doctors are being asked to do things that are not just challenging, but really are contrary to what they feel they should be doing as a doctor, whether it is prescribing a medication that is not the medication that they want to give because their system won't cover it, or some other thing. And we've got a hard break right here, Marty, so I'm going to have you call back in, and we're going to go to a commercial break, and we'll be back, so stay with us.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
You're back in the Doctor's Lounge. This is your host, Dr. Hal. We are broadcasting live on the America's Web Radio page and also on Facebook. And Facebook viewers and listeners can type in questions, and we'll try to incorporate that into our conversation with Dr. Marty Koyle, our guest, who is the chief of pediatric urology at Toronto Sick Children's Hospital. And he has recently penned a piece that brought together physician burnout as well as the possibly the single payer healthcare system. And Marty, when we left off, we talked about whether or not this is really something that is a phenomenon that is that falls into the doctor's realm, or is this something that's happening to them? Because I think burnout implies that doctors are just facing challenges and they're not able to meet them and they're burning out, versus what I like to say is something that's happening to them and creating a serious reaction, a PTSD kind of reaction, because of things that doctors are now compelled to do that's contrary to what they are, their Hippocratic oath, or just what they have been trained to do. What say you?
Well, I like your concept of PTSD. I don't think either of us are true experts on the subject, but the reality is, I think that if you look at some of the parallels, we certainly have those similarities. But the reality is, hell, when you look at what we do, and we're not smarter than anybody else, but in general, what we've had to go through in our whole careers has been competitive. We've had to go to the best colleges, had to overachieve to get into medical school, compete to get into a good residency and training program, ultimately into a job. And we weren't trained to be businessmen. We weren't trained to be leaders. We weren't trained, and we're not necessarily very good followers either, which makes it very difficult. And what happens, especially when we're in a group mentality, where we're physicians who don't all think the same, don't have the same ideals, and we lack the leadership that we may have had at one time, we've lost control. So the system controls us rather than us being part of the system and having us determine our fate. And anytime, I don't care, again, what field or facet you have as a career or a vocation, but if the bar keeps getting higher and higher every time you jump, and you keep working and working to make that bar, and eventually the bar reaches a point where it's unachievable. And I think that's what has happened to many of us in medicine is over the last 20 years when we see the evolution of the internet and emails and cell phones and corporate medicine. There's been so many changes that have influenced us that it's taken away our passion for the actual giving and relationships that we have with our patients.
Marty, you experienced what I would say was the best healthcare system in the world, the U.S. healthcare system. You practiced your entire career there, and you have been like a salmon swimming upstream instead of coming downstream like so many Canadians have done. They've escaped the Canadian healthcare system, trying to gain entry into the U.S., and you've gone against the grain. Tell us what that experience has been like.
It's funny how, as you know, I lean a little bit more left or centrist than you and maybe some of your listeners do. And as a Canadian with dual citizenship, I'm also a proud American. I went to medical school in Canada and left immediately after I finished as a career choice, not necessarily reflecting my feelings about American versus Canadian medicine. It's interesting that my first relationship in the United States and training was at a county hospital where I felt the care that patients received, and I'm proud to admit that I was at Los Angeles County Hospital. I thought the care there was really, really great. I thought it was a team approach. We practiced really good medicine. We worked hard. It was a team relationship. And when I had left Canada in 1976, graduating from medical school, I saw a pretty new system, the Canadian healthcare system of a single-payer system. And it's not truly a single-payer system, by the way. It's 14 different systems based on each province and territory having their own system. I thought it was, in concept, a good idea, okay? I came back 40 years later, and it was if I had walked in the front door and came in the back door and nothing had changed. So when I compare it, I look at a system in Canada in many ways that reflected my experience in VA hospitals in the 1980s. So again, I can't say what the experience is today, but in the 1980s, when I was a resident at Harvard, we rotated through the VA system, and we would have massive clinics, 70 to 80 patients, really no rhyme or reason behind how and who they came in, and it was really a volume-driven system. The difference was I felt that the veterans deserved great care. They deserved our attention, and the relationships that we had to have with them, I think was great. I mean, you felt a strong relationship. In Canada, we're in the same volume-driven system. So in my clinic, I'm asked to see an inordinate amount of patients who are run through sort of an assembly line fashion based on first come, first serve. I don't know their physicians like I did in the States. I don't know them, the families personally. I don't know the children personally. So it's a much colder relationship. And that's what I think has affected me the most, that I don't feel there's this, I think there's an entitlement here that's very different than the entitlement that I felt the veterans deserved in the United States.
I don't think
that makes sense.
Yeah, it does. And I don't think that veterans actually feel entitlement, to be honest with you. I think that they are probably, as a group, the most appreciative patients
that I have ever taken care of.
Absolutely.
But I think that what you really are seeing in Canada is can be compared really to the Medicaid population in the U.S., who believe that healthcare is a right, that the physician is not a professional, but a cog in the wheel of something that they are entitled to, and they have no skin in the game. I think you've written in your piece that people don't show up for appointments, they're late for appointments, they don't follow instructions. These are the I don't mean to paint this with a broad brush, but I think that by and large, the group of patients that we see here in the U.S. that fits that bill are the Medicaid patients, who are the largest group of no-shows. They make appointments and then they don't show up for them, and because they really because for them as an entitlement, healthcare has no value, and that's the sad reality of, I think, what happens when you really don't have any skin in the game.
Well, it's interesting that you bring that up, because I think that's probably one of the major issues, is that if you feel it's entitlement, and again, I echo your feelings about the veterans, that there was a great appreciation for the care we provided for them. And I felt the entitlement was we were entitled to provide them with great care because of what they've done and what they do for our country. But I think when healthcare becomes an entitlement, and the concept to the consumer is that it's free, to me is the problem. Is that here, we pay a huge amount of income tax, much of which goes into the health system, just like the United States. It's a huge portion of our GDP. But the reality is that people look at it as free, and they don't realize they're actually paying taxes into the system to support it. And as a result, they're responsible for it. I think when you pay taxes, you have a responsibility. And likewise, the government has a responsibility to assure that they're getting the best bang for your money. And I don't see that happening. And I think that that's going to be problematic with an aging population as we keep people alive with more diseases, where the costs of medicine and technology continue to increase.
Marty, I know that you follow what's going on in the U.S. very closely, and we're going to a hard break. So I'm going to give you this question, and then we're going to break and come back and have you answer it. But you know that right now the political environment in the U.S. is very charged, and one side is claiming that the solution is a single-payer healthcare system, or Medicare for all, which is socialized medicine. The other side is fighting back, pushing back very strongly against that, and acknowledges that healthcare is broken, but it's not an either-or proposition. So I would like you, when we get back from this break, to comment on that, to weigh in, and to answer the question: is that the direction that the U.S. should be looking at in terms of revamping the healthcare system? So stay with us for the answer in the Docs for Patient Care. In the Doctor's Lounge on America's Web Radio.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal Scherz, every Thursday morning, 8 to 9 a.m.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
We're back in the Doctor's Lounge with my wise guys here today, and my guest is Dr. Marty Koyle. We've been talking about single-payer healthcare and physician burnout. Facebook listeners, watchers can get live questions. I'll have a question after Dr. Koyle answers the last question that I left him with in the break. Marty, can you comment on what we just talked about regarding whether or not the U.S. should be thinking about single-payer health care?
So I think that's probably a very complicated system because of the layers in the U.S. health system already. There's private hospitals, there's for-profit hospitals, there's not-for-profit hospitals, there's county hospitals, there's city hospitals, there's VAs, there's military hospitals. In Canada, they've all been rolled into one. So everything has sort of, I think, gone down to a medium rather than to having a top-bottom approach. So you have centers of excellence here. There is a referral upstream. But what we talked about before now is the issue of skin in the game. And I don't think the system here works because single-payer system where the consumer has no skin in the game. So North Korea, Cuba, and Canada are the only systems with no alternative to their single-payer, no skin in the game system. And I think that the U.S. has to be very cautious because all of a sudden suggests that we have only a Medicare system with a single-payer with a very huge model that likely, from a business perspective, is controlled by non-physicians, and where it becomes a business is potentially dangerous. So the great thing about the American system is the competitive market, that one system does have to compare itself against its neighbor in order to succeed, and that's been no different than any other business model, and no different than your physician group compared to some other physician group. If you do a good job, you're going to continue to get patients, and if you provide proper care and have good outcomes, you're going to continue to be rewarded for it, rather than just saying you are a commodity in a system where everything, again, becomes an entitlement. So do I support the concept of having health care for all? Absolutely. But do I also support the concept of health care for all, meaning you have skin in the game? Definitely. But also with the proviso that there needs to be a second tier, that the people have the income, can afford supplementary insurance, want a nicer hospital, want their surgery done sooner or by a specific physician, and they can afford the supplementary insurance. Great. I think the key is to get rid of the uninsured and have health care for everybody, but at the same time, I don't think a single system with a single payer that's controlled by a bureaucracy will be successful in the United States, especially to consumers who are used to the current system.
And unfortunately, that's what's being served up to the American electorate, where there are two plans that are being discussed in Congress, one in the House and one in the Senate. Both of them are based on a system where they would outlaw the private contracting between a patient and a physician, including employer-based health care. Everything would be outlawed. Doctors who participate in that would be criminalized. And so this is really, I think, a fool's paradise to think that you can have a system where everything that you want is covered. And they don't realize that in places where they have a socialized healthcare system, that the only way to afford it is to ration the care.
So how what I have in my system right now is that if I train somebody to do what you and I do, they can't just put a shingle up and compete with me. There has to be a position which is allocated by the government for them to compete. So I have no competition. I can do a lousy job or a good job. It doesn't matter because I know there's no competition, and that's not good. The other thing is that right now our family, so we have more of a primary care approach here where you have to go to your primary care provider in order to see a specialist. There has to be a referral made. So unlike you, where a patient may know what a pediatric urologist does and can make an appointment to see you directly, I can't see someone who wants to see me unless they've gone to their family doctor first. The problem is the family doctors are so inundated now that they become just a referral service, and I think they're losing pride in what they do. And many of them now have signs on the wall limiting the number of complaints that a patient can have when they see their family doctor. So if you have 3 different problems that come in, you have to make the decision, and you're not the doctor, as to what your choice is to see the doctor at that time, and then set up 2 more appointments for your other complaints. To me, is criminal. That's not what we.
No, that's really very scary. I have a Facebook question from Victor who wants to know, if healthcare is a right, then wouldn't it mean that everyone would have a right to the sweat equity of a doctor? In other words, I can demand that a doctor give me their time, their expertise, care in general at no cost. I just demand service as if I own part of the said doctor. What do you think about that? How do you respond?
So I think that question in many ways, and I think to some consumers here, they feel that that's exactly their right, is that they should, their health care is free, and they can demand an answer and an opinion at their leisure.
Isn't I don't mean to make this more political than it is, but isn't that slavery?
I guess you could define it any way you want, but again, I'm not saying we should have a paternalistic doctor-patient relationship, which is the way you and I grew up. I think consumers are more savvy now. The internet has given them a lot more ideas and concepts of medicine, right and wrong. So there's good and bad about what patients know. But the reality is, I think that much of what we do now is based on discussion and involvement with the patient. And it's not just that the patient can have a demand. And you and I both know that many patients do come in asking for a certain surgery or asking for a certain medicine, and it may not be the right answer for them. But you know also, which is one of the foibles of the system, is that they will eventually, if they search long enough, find someone who will do that surgery or will provide that medicine, and that's not right either.
Yes, that's absolutely correct. I would agree with that. You know, Marty, many Canadians have used the U.S. healthcare system as a safety valve because of the unavailability or limitations for urgent or specialized care in Canada. If the U.S. went single payer, socialized healthcare, outlawing private practice, what would that mean for Canada?
So, you know, I can tell you that complex care in Canada is done very well, as is primary care. The things that are a big issue that I see here are the queues in the system, so people are waiting, especially for quality of life issues. So it's non-life or death issues. So for instance, if you or I needed a hip replacement, and you're working right now, Hal, if you were told you were going to be in pain, you'd have to take time off, this, that, or the other, and wait 6 months because that's what arbitrarily the government has said you have to wait, and you're not seeing patients, you're not working as hard, so you can't pay taxes, you're not paying the same taxes into the system that you might have. Nobody's looking at that other revenue and the effect of that, plus you're suffering. Who knows, you may become a drug addict because you need a pain relief for that. So unlike in the States where I know that if I needed a hip replacement, I could get a referral tomorrow and I could have the surgery next week if I wanted. And that's the reality. Here it's not. Here there's going to be a queue. There's going to be a queue for a CT scan. There's going to be a queue for an MRI scan. Anything that's quality of life or diagnostic is going to not be taken care of in necessarily a timely, on-demand fashion, the way you and I are used to in the United States. That being said, however, if you have a critical illness, I can tell you that the care is superb here. Cardiac surgeons are superb. The cancer care is superb. And I think the physicians, the nurses, everybody else in the system are just as committed as they are anywhere. But the reality is really the quality of life issues, the patients with glaucoma, cataracts, issues like that may also affect your job, your ability to drive, everything else, that are really an impediment that I don't think an American would tolerate in a single-payer system the way it is in Canada.
So a few years back, the premier of Newfoundland, Danny Williams,
right,
went to Miami for
to have his cardiac surgery.
Exactly. And he took a lot of flack in Canada and said that this is his health care and it's his health he's concerned about, and he'll do whatever he feels is necessary for him to be able to take care of himself. So, I think that's a marvelous thing, and people should be able to do that. And what I just am astounded by is the direction that this conversation is taking in the U.S., how far left this has gone, and what are these people who advocate for this kind of system thinking that they're going to do when they no longer have the safety valve?
So, if they're going to the alternative, i.e. also a second tier, and again, I don't like to look at that as an elitist way, so you brought up Danny Williams. And I think, if anything, that exemplifies a two-tier system. Here's somebody who has the means or the policy to have his care in place that he's not provided the best care for him. And shouldn't he have that right if he doesn't have the ability to do so? That's what democracy is all about, when you have choice. When we decide that socially something is necessary, and that means health care for all, that's a different agenda. And I think, again, that's our humanistic goal, is to care for everybody, make sure they have at least critical illness and basic illness taken care of. And, if you have the alternative, you take advantage of it. And it doesn't mean it's elitist. It means that you've worked hard. It doesn't mean that you've inherited money so that you can pay for your insurance. If you've worked hard and can afford the insurance to care for something in a private fashion, you take advantage of it.
Yeah, we've gone a little bit long. We're going to take our last break and then finish up with my guest, Dr. Martin Koyle, in the last segment in the Doctor's Lounge. So stay with us.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Whether cruising the strip in a 57 Chevy or taking the family on a vacation in a 71 Oldsmobile Vista Cruiser, you need to tune in to Classic Cars with Steve Ronaldo and Jim Weber every Saturday from 8 to 9 a.m. on americaswebradio.com.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Thanks for being with us today on our inaugural Facebook live feed. This is something that we're hoping will take off, and that Facebook listeners will get questions in and give us an opportunity to answer. And Victor's been very busy on Facebook, and we really appreciate that. So we hope that this will be something that we can incorporate as a regular part of this show. And Dr. Marty Koyle has been good enough to be with us this hour and talk about his experiences moving from the U.S. to Canada with free market. Well, I don't know if you can call the healthcare system in the U.S. free market, but more free market than in Canada, and his dilemma facing changes and realizing physician burnout. Marty, you in your article have mentioned that there are ways that people should be able to cope with physician burnout. I would be interested to hear your thoughts about how that might be possible. Marty, you there? Did we lose him? Oh boy. All right.
Do you hear me?
Yeah, I can hear you now. Can you hear me?
Yeah, sorry. I heard your question. So I don't think there's one answer for all. I think we, the way I dealt with it was first to realize that I wasn't the same person who I was. I was becoming more cynical. I was becoming angrier. My relationships at work were not what they had been. And so I had to say, what is it? I had to look in the mirror, and I didn't just see a guy who's getting older. I saw a guy who was really not satisfied. And when you do that, you take a step back. And for me, I went on the internet, read a little bit more about burnout. So again, something that I think in the piece, I admit that I didn't think it could ever happen to me, being a workaholic. I mean, I thought, I could go forever. And then I realized I wasn't the same person. So what I did is I went to my family doctor because, again, you can't see another doctor without getting referred. And my family doctor took a lot of time with me. We sat and talked. And she said, "Do you want to see a psychiatrist?" Which I said, "I don't know. How's the psychiatrist going to help me?"
Did you say, "Are you crazy?"
Yeah, I didn't see that part of it. I didn't hear, but I guess I should have seen that. And I went to a psychiatrist who has been invaluable. I mean, I haven't needed any medication or anything else, but it's allowed me to vent to somebody who's an independent observer. And I must admit that one thing about the single-payer system here is my psychiatric care, or my therapy with her, is is totally paid for. I don't pay a nickel out of pocket for that.
Do you show up for your appointments?
I'm always 5 minutes early for everything.
That's your American training, not your Canadian.
Yeah, absolutely. No doubt about that. Time is money. So the answer is I did that, and I've also taken time during the day where, I never thought I just close I've always had an open door policy in my office. I now close the door for 15 minutes every single day in the afternoon, and turn off the lights in my office, turn off my computer, turn off my cell phone, and just sit there and think. Just ask myself, okay, what am I doing today? What, am I pissed off at anybody? Did this bring me satisfaction? And I try to then think about other things. I mean, the beach, an upcoming trip, a good meal, whatever it turns out to be. But I then try to redirect myself to something totally non-medical. The other things I've done is to really make sure that my other interests outside of medicine have been optimized. So I've gone back to music lessons. I go to the theater more. I make sure that I'm cooking more, which I used to love to do. And so the reality is, I think you have to broaden yourself and extricate yourself from where you see the problems, but not deny that those problems are there.
So that's me time that you are talking about.
Absolutely.
But I bring this back to the fact that you're talking about coping mechanisms, and I think it's very important for people, regardless of whether they're physicians or they're lawyers or accountants or any field that has strain on it. You need to, number one, have coping mechanisms, and number two, have me time. But when you and I started in practice, it was not unusual to see doctors who were in practice well into their 80s, and lots of them, not just a few, but lots of them. You had to force people out of practice. And nowadays, people are heading for the exits. They're thinking about it in their 50s or in their early 60s. And I don't think that doctors have changed. I think that it's the environment that has resulted in this, and this is very dangerous for patients. We just got about 5 minutes, Marty, so we're going to wrap this up.
Well, Hal, I think you also have to look at what today's medical students want to go into, and unlike you and me, they're going into shift work jobs. And I hate to say that that's not meant to be a negative,
but it is.
But it is a quality of life issue. So there's anesthesia, where they don't have to have their direct one-on-one patient care day and night. Dermatology, where there's less emergencies, which again, a great field. They do a great service. Emergency medicine, those who finish internal medicine are becoming more hospice, again based on shifts as time goes on. So the reality is lifestyle has a huge impact on what people do nowadays, whereas I think you and I grew up in a different era where we didn't mind the 80-hour or 90-hour work week, and we actually relished it. We wanted more.
Well, I think we identify as physicians first. That if people ask what we are, we identify as physicians, and I think that the young people today don't view medicine so much as a career, but as a way station in life. And they're thinking that there's going to be other things for them to do.
And I don't know if that's completely good or bad. There's also more medical schools than there were when you and I went. So that, again, hopefully the job market for the people who chose careers like us are still plentiful. But I don't negate the importance of people who have chosen quality of life careers. I think they've made a decision, but it also reflects the difference in people who are in medicine today and how medicine has changed. You've got to remember, when you and I were in medical school, full-time emergency medicine was just starting.
Mm-hmm.
Hospitalists were unheard of.
Right, that's right.
Interventional radiology and things like that were unheard of. So medicine has changed, and the opportunities and careers have changed as well.
Which is not necessarily beneficial for patient care, in my opinion. So,
Right.
So I have a question, last question. If you had an ability to turn the clock back a bit, would you go back to Canada, or let me ask it a different way? Do you regret leaving the U.S. and going to Canada? Do you think that that's contributed to some of the problems and challenges that you faced?
So I'm one of those who, once I've made a decision, I try not to look at it as a bad decision. I try to make the most of what I've done. I think I've gained a lot by coming here. Likely, had this been earlier in my career, I'd be looking at opportunities to come back to the United States. I'm not denying that. I think I enjoyed my practice of medicine and the way I dealt with patients far more in the United States. I love my academic side. I love my teaching side here and mentoring. I love the fact that I went on and did a master's in quality improvement patient safety, which I think has really enlightened me in many ways, and also given me a lot of joy in pursuing that as a new avenue, and hopefully something I can do when I ultimately retire from clinical medicine. So the answer in many ways is sort of a guarded. It really depends on where one is in their career, but had I been younger, yes, I would have come back to the States.
That's I think, a very telling answer for those who are telling the American public how great a single-payer healthcare system can be. So, Marty, I appreciate you sharing your story with our listeners and taking an hour and talking with us. I think that I've had a really good time talking with you today, and I hope that you've had a good time as well.
I've really enjoyed it, and look forward to coming back if you ever want me.
Oh, Marty, I can promise you that we do want you, and we will have you back here in the Doctor's Lounge. So,
Okay.
Again, I want to thank my Wise Guy team in here today who've helped me on Facebook, and I hope that the Facebook listeners, watchers, will tell their friends and share this with them so that we can build on this platform, because I think it's really a great opportunity to get the listening public involved in the conversation. So come back with us. I'll be back in 2 weeks. My co-host, Dr. Mike, will be here next week, and I'll be back with you in 2 weeks on the Doctor's Lounge. Thank you.